Hello everyone, welcome to Wellness Wednesday. Lindsey the pharmacist here, Wellness from D Consulting. And I appreciate everyone's submissions and patience with me this week. It's been nuts. So I got a couple topics that cross over, asthma and allergies. So this week's Wellness Wednesday, we're gonna focus on asthma attacks. And asthma, most people know, is a breathing condition, right? It's a chronic lung disease typically caused by allergies. Those can be allergies to the environment. They can be allergies to like smoke, pollution, dander, pollens, or they could also, asthma can be caused by medications, surprisingly, and emotions, like high emotions, laughter, actually, stress. I also have been diagnosed in the past with exercise-induced asthma, which I think can come from that amount of stress you're taking on, plus the maybe exercise anxiety that might lead to something that resembles asthma and or a panic attack. Maybe I was misdiagnosed. Anyways, so asthma comes in multiple forms, whether it is a severe all the way down to like a mild, and it comes from allergies, medications, environment, emotions. So we've covered the causes. Now, how is it diagnosed? Well, you go to your doctor and they do a spirometry test or a peak flow test. You breathe out into the little dialer and they decide if your lung function has been compromised. You can use those for a lot of different things as well as like COPD. Because of the range and severity of asthma, there are a huge range of medications, and those medications aren't solely used for asthma. So I actually have some things here today because of my occasional exercise-induced asthma, and my son had RSV twice under one, and that causes some inflammation and lung damage and scarring that he will eventually grow out of in his elementary years. But in the meantime, he is more at risk for lung problems, disease, or not disease, but when he gets an infection, he's at more risk for a pneumonia or an upper respiratory to develop because of his wheezing and his capacity. So not only do I get him on his like SBI Protect, zinc, and vitamin A, but if it's a respiratory, we have Flovent and a spacer, which you can use for kiddos. Super easy. Puff in here. They breathe for 10 seconds per puff. The Flovent is a long-acting. There are long-acting inhalers that work on bronchodilation and inflammation. There are short-acting or rescue inhalers such as albuterol. The process of using them is the same. It's just the frequency of use. So Flovent is twice a day, sometimes once depending on your doctor. Albuterol can be every 4 to 6 hours. It does have some crossover and cardiovascular effect, can make kiddos and people jittery and cause some heart palpitations. So rescue, etc. There are other ways to manage your asthma by managing some of your allergies. So we would recommend looking at leukotriene modifiers like a Singulair. If that's not something for you, an antihistamine every day like a Claritin, Allegra, etc. I always add DHIST to anything allergy related because DHIST can be taken with allergy medications, and it also reduces your histamine. It's made of bromelain, quercetin, vitamin C, stinging nettles, all things that reduce the histamine response and powerful antioxidants. So these are great for allergies and asthma. If you want some up now, hook you right up. What I also wanted to talk about is that this doesn't have to inhibit your life unless you have a very severe case. There's a lot we can do to manage to strengthen your lungs. My grandpa was a smoker his whole life, and in his 60s he quit, and he was doing a lot of respiratory therapy. I remember sitting with him actually in college, and he was telling me about learning how to drop his diaphragm and breathe deeper and open his lung capacity because of all the damage he'd done. So I would say if you have asthma or you know someone with asthma, please talk to your doctor. Call me, reach out. I would love to help you find ways so that it doesn't inhibit regular life and your ability to do fun things. We can manage cause and effect and all that stuff. That is your Wellness Wednesday. I appreciate you guys tuning in, and share this. Please drop a comment below. Have you been affected by asthma? What's your story? I want to know. Have a great day. Thanks. Bye.